Sorry, ayan. This is your aneurysm. Let's talk about its definition. I did mention from last time that you have our discussion. It's basically a weakening in the walls of your blood vessels. So let's specifically dive into that one. As you can see in this picture or in this slide, it shows to you this tension. Ayan, yan yung particular medical term there. Let me... There we go. Yan. This tension of an artery brought about by the weakening or destruction of your arterial wall. Let us remember that our blood vessels, specifically our artery in this case, have layers. Diba? Ano yung mga layers? Anatomy and physiology. Ano yung mga layers ng blood vessels natin? Can you still remember? Let us call people. Sige nga. It's your anatomy and physiology kasi pinag-uusapan natin dito blood vessels. So, let me call people. Ayan. Sino ba yung mga nag-raise ng kanila? Miss Bukasas yan. Kasi nga, hindi ka nag-respond immediately. Miss Bukasas, can you still remember the layers of your blood vessels? So that we will be explaining the pathological mechanism of the disorder. Yes. Miss Bukasas. Yes, Miss Bukasas? Wala. Saan si Miss Bukasas? Bakit wala? Yes, Mr. Bacalso, I see that you're raising your hand. What are the layers of your blood vessels? You can remember them. Correct. Ito yung blood vessel natin. Tapos, ganyan yung diameter. Di ba? Diameter ng ating blood vessel, you have the innermost layer, okay, as your tunica intima, okay, and the middle part of that blood vessel. My apologies for my drawing, but you can understand what I'm trying to say here. That is your tunica media. And yes, sino yung nag-raise ng hand? Yes. Okay, Miss Mukasas, noted. And then finally, you have your tunica adventitia. Sorry, bakit ganun? Adventitia. So that is basically your layers of your blood vessels. Now imagine kung yung artery mo, talking about the artery in itself actually accommodates a very high pressure blood flow. Okay, high pressure blood flow yan siya. And it accommodates again your oxygenated blood. It's a very important part of your vascular system. Now imagine if your artery, a part of your artery is actually weak. So, yung layers na mga nakikita nyo dito, the layers of your blood vessels or the walls are actually going to be very much have alterations. Okay. Hence, that's where you can see, okay, dapat ganito yung wall natin. And usually, it's in your tunica intima. And nagsastart sa tunica intima natin yung weakening ng ating blood vessels. Usually, it's going to be free-flowing. Ganyan yung blood flow natin. Diba? Unfortunately, for people who have your aneurysm, we have what we call as your possibilities for dissecting or the tearing in the layers of your blood vessels. So, you have that layers, yung tatlo na yan, pero because there is that weakening, ang tendency niyan is napupunit po siya. Pag napunit yan, you're going to be expecting that, okay? This is your healthy, normal blood flow with your healthy, wait lang, palitan natin yung kulay. Yan. With your healthy blood vessels. And then, this one here, there's a possibility na yung layers dyan, mapupunit siya. So, mapupunit yan siya. Ayan, mapupunit yan siya. Ayan. Magsistart yan siyang this part here is going to be weakened. So, there's a tendency na, kasi napunit na siya, no? Itong part na ito, napunit yan siya. Going to this area, some of them might actually go to the area where you have your walls. And that's not the case, kasi ang diameter ng blood flow mo, dire-diretso yan. Pero kung may punit yung wall mo, some of them might actually go here. And that will actually include more pressure on that affected part or that torn part or the dissected part of your arterial wall. So if that happens, ayan, constant pressure, it's going to be in between the walls because there's a tear in the walls. And then hence, because that happens, this becomes weak. Kaya yung weak part na yan, because there again is your constant flow of your blood pressure, very, very high blood pressure because of your artery. And, well, that's your normal pressure sa arterial walls mo, di ba? But it can be compounded kasi nga, merong history yung pasyente natin ng hypertension. Okay? Uncontrolled hypertension, for that matter. Or there is a history of your hyperlipidemia. May mga plaques dyan, may mga fatty plaques dyan. You have your fatty depositions. Apart from that one, you also have a history of diabetes mellitus, kung saan the blood flow or the circulation is actually slowed down because there's a lot of components in your blood, inclusive of which are actually your sugars. Hindi ba? So, alam mo yung patong-patong, the history of our client has that, magnified effect because several comorbidities that he is actually experiencing. Okay? So, yung patient natin, ayun nga, sabi ko, has history of your, yes, for a while. Okay. So, your patient has a history of your DM, tapos na-start na siya ng insulin, merong hypertension, merong hyperlipidemia, tapos meron pang problem with your aneurysm. So, that makes it all the more complicated. Now, if that actually happens, sabi ko, this will actually become bigger because this is already weak. And most of the time, when you have your aneurysm as a diagnosis kasi, ang problema dyan is that most of these are actually asymptomatic. Sabi ko last time, accidental yung finding na usually na nakikita ng mga doctors from this particular patient. They would go on with their usual daily activities of living, not minding what's actually wrong inside. Kasi nga, walang manifestations. There are no clinical signs and symptoms that are quite observable. When you do have, for a while, lagi lang ha, ayan, makulit. Okay, asa na tayo? Sinabi ko, ayan, most of the people who have your diagnosis of your AAA would not know that they have the disease because it's asymptomatic. They don't know, they have no manifestations at all. And most of the diagnoses are actually accidental or incidental. Yan yung nangyayari sa ating AAA. So, let's move on. There are different types of your aneurysm. So, unang-una dyan, we have your aortic aneurysm. If you can remember our vascular system, di ba? From your heart actually pumps out your cardiac output or your blood volume to your aorta. And your aorta is actually ganyan. From your heart, this is your heart, okay? And it actually distributes, okay? That's your aorta. some of these bloods actually distributed to the upper part of your body, and some of them actually goes down. Yan. Itong pababa na aorta, that's where you have your thoracic aorta. Okay? And you have also, let me proceed here. This part here, kasi ito your upper torso and your lower torso, right? Now, this part here, this aorta, actually has your thoracic aorta and supplies your blood or supplies the organ in your upper torso. And then we have here the lower part, which is your abdominal aorta, which supplies your organs found in your abdomen, and that would include abdominal cavity, and that would include all of your intestines, your vital organs from your gastrointestinal system, as well as your kidney. Actually, yung abdominal aorta natin facilitates the circulation in your renal area as well. So, malapit po siya sa ating kidneys. Actually, ayan. It's your kidney here, ayan ang kidney mo dyan. Diba? Ngayon, when we're talking about aortic aneurysm, there are different types. Okay? So, this is just a review of your anatomy. Ayan. Aortic aneurysm, two major is your aortic aneurysm, your abdominal, that's your triple A, and that's your thoracic aneurysm. And it's basically a matter of location. Kung saan yung weakened na part ng blood vessel mo, okay, if it's in your upper torso, that's your thoracic cavity, and that of your abdominal or your lower torso, that's your abdominal cavity. Okay, so imagine if you have a rupture of your aneurysm that happened in your abdomen. Most likely, okay, you will have a leakage of the blood where affecting your peritoneal cavity. If you can remember our discussion about leakage of your gastric contents. Kapag nagkakaroon ka ng PUD, di ba meron tayong mga leakage ng gastric contents because of your ulcerations. Tapos, nagkakaroon ng sepsis doon sa ating abdominal area and affecting your organs. Okay? Take that principle when you have a rupture of your abdominal aortic aneurysm. And most likely, it's not your gastric contents that's going to be leaking out. It's actually blood, okay, all over the place, all over your abdominal cavity. So, most likely, ang pasyente mo talagang nauubusan ng dugo dito. There is massive internal bleeding. Okay, there's massive internal bleeding. Same is actually true when you have your thoracic aortic aneurysm. Okay, again, I would like to reiterate that your weakening, okay, is not overnight. It is guided by a lot of risk factors, or it's actually based on years and years and years of development of that aneurysm. Kasi, yung weakening mo, hindi naman siya nangyari isang beses lang. Okay? There's a lot of factors that has to be considered here. So, most likely, as I have emphasized earlier, yung mga aneurysms natin, they are asymptomatic because they only come out in the open if it's already too late. If you have already manifestations of the severity of the disease. Okay, kaya yung mga patients natin, most likely, magugulat na lang sila, meron silang ganito na mga diagnosis. Okay, so that is for your aortic aneurysm. We're talking about the aorta. Now, let's go to your cerebral aneurysm. Your cerebral aneurysm is highly also associated with risk factors such as hypertension, okay, yung mga history ng traumatic brain injury, or even because there is your stroke. Yeah, actually, most of these hemorrhagic stroke, are actually associated with your cerebral aneurysm. I think this has very much been explained to you in several LPs on stroke and CVA from before. Okay? I would like to also reiterate the concept of watchful waiting for your aneurysm. Okay? Watchful waiting. Ibig sabihin nun, most of the cases who had incidental findings, yung alam mo yung nalaman na nila na meron pala silang weakened part doon sa blood vessels nila, or those who have your aneurysm, most of them are actually needing close monitoring. Kasi wala kang magagawa. The indications for surgery needs to be that the aneurysm is actually big. Okay, large aneurysm, those are the indications for your surgical repair. But if it's small, there's nothing you can do about that one, but to have watchful waiting. Kasi there's a lot more to have drawbacks, mga disadvantage, if you will immediately do something about that. Okay, kaya nga, asymptomatic siya kasi nga, wala pa masyadong makikita na mga complications. Wala pa masyadong mga mechanisms of alterations in your body system that's happening with very, very small sizes of your aneurysm. Hence, when you are diagnosed to have aneurysm, tas maliit pa lang siya, you are subjected to have a change in your lifestyle. Kasi alam mo ang mga risk factors ng aneurysm. You know the risk factors for aneurysm, right? So you need to have a change in the lifestyle, and at the same time, you need to have watchful waiting. Watchful waiting kasi nga, if in any case it grows bigger, and that's the time that you are indicated for your surgical repair. Okay. If I can remember it correctly, yung ating aneurysm, it's really about an increase. Okay, increase in the size and diameter of your blood vessel. Okay, of your blood vessel. So again, like what I have discussed earlier, it's a matter of understanding the pathophysiology in the concept of the layers of your blood vessels. So aneurysms are identified as such if it is more than 50% of the diameter. There's a growth or there's an increase in the diameter of more than 50%. Okay? And most likely, yung mga large abdominal aortic aneurysm natin. Large abdominal aortic aneurysm, okay, wait lang, are identified as such if it's more than 5.5 cm. Mukhang maliit lang siya ha, pero sa totoo lang, you know that the size of your blood vessels are very, very small. So imagine if it goes to that size. Okay, it's already a red flag. Okay, and this large AAA is also indicative of surgical repair. Okay, you do not expect surgical repair to actually happen if your aneurysm, I would like to repeat, is small. Okay, is small and asymptomatic. Okay, asymptomatic. Usually, again, it's all watchful waiting. Okay. Parang maninervous ka talaga because you know you are diagnosed with such. And you don't know what the future will hold for you. That's why you are given this chance to change, have a 180 degree turn of your lifestyle. Okay? Others, you have also your peripheral aneurysm, but it's not too common when you have your peripheral aneurysm. Most likely, ang mga meron tayong blood vessel disorder, it's associated with your ischemia, and that's your peripheral arterial disease or maybe your peripheral vascular disease. Pero wala pa ako masyadong na handle. Actually, wala na handle na peripheral aneurysm. It's most your cerebral aneurysm and one case of your AAA. Okay? So, ito ang itsura ng ating aorta. Sabi ko, di ba kanina, you have your aorta that facilitates distribution of your oxygenated blood to all of your body parts. So, some of them go up and that's to your brain, okay, supplying all of your organs and particular anatomical structures in the upper part of your torso. Now, we have here, babagsakan. This is what we call your descending aorta. And that descending aorta, ayan po, sabi ko kanina, let us, ayan. Yung upper torso natin has your thoracic cavity, and hence you have your thoracic aorta supplying the areas of that thoracic cavity. And you have the lower torso, itong lower torso na ito, which is actually accommodated by your abdominal cavity. Hence, you have your abdominal aorta to supply your vital organs found in your abdominal cavity. Yan. Sabi ko kanina, di ba? Ayan. Meron silang close association with your kidneys. And hence, your kidney, remember, the function of your kidney is actually responsible for regulation of your blood pressure. Kung ikaw ay may problema pa sa kidney, tapos meron ka pang aortic aneurysm, good luck talaga sa'yo. Sobrang taas ng blood pressure mo. To the point that, yes, you are at risk or susceptible to have your abdominal aortic aneurysm that's going to be leaking or ruptured. Okay? As you can see, this is how it actually looks like. That's your thoracic aortic aneurysm. Again, it's a matter of change in the size and diameter of your blood vessel. Ayan. You might think that blood vessel lang naman ngayon, why does it even matter? It's because there's a possibility for rupture to occur, and that's the complication that we don't want to happen. Kasi it's very fatal. It's a medical emergency. Mahirap pong maghabol. And you know, we're talking about blood vessels here which are very fragile. Maliit lang po yung mangayaan. Hindi katulad na when you have your liver problem or when you have your stomach problem. We're dealing with larger organs here. But this one here, we're talking about blood vessels which are very tiny. And you know, in local hospitals, I think hindi pa masyadong established yung mga surgical repairs ng mga blood vessels natin. I don't think we have a sophisticated team to handle yung mga ganitong repairs. Although I know in Lorma Medical Center, meron silang cardiac cath lab, meron silang facilities to provide your intervention. But I think in ITRMC, parang hindi pa masyado ang kanilang team for the repair of your aneurysms. Okay, so that's how your thoracic aortic aneurysm looks like, and this is how your abdominal aortic aneurysm looks like. Okay, well, let's go back. Abdominal aortic aneurysm, saan sila nag-occur? Doon sa abdominal portion of your aortic aneurysm. Ano ang sinusupply ng ating abdominal aorta? As I have mentioned, it has a close association with your kidneys. So hence, nagsusupply siya ng blood doon sa kidneys natin. At the same time, it also supplies blood to all of your vital organs in the anterior part of your abdomen. Okay? So, yung mga liver natin, intestines, your stomach, your bladder, etc. Bladder is on the posterior part. Yung abdominal aorta natin facilitates, again, distribution of blood to your anterior part of your abdomen, which is basically your GI system or your GI anatomy. And then your renal part, which is the posterior area of your abdominal cavity. Okay? That is your abdominal aorta. Kaya, kung for example, kung meron ka mang abdominal aortic aneurysm, always associate it with the organs that are very close to that abnormal blood vessel. So, kaya yung patients natin, they complain about what? If in any case, it has become very large, if the aortic aneurysm has become very large already, and there's a possibility that there is already your dissection or rupture or leakage. Ang complaint usually niyaan ay, ano na ulit yung mga sinabi natin doon sa preliminaries, it's your abdominal pain, as in sobrang sakit ng tiyan nila. Okay, but if you're going to look at the history, wala naman silang kinain. Wala, bigla lang nangyari na ganyan. Another thing is, there might be referred pain. Referred pain, ibig sabihin nun, from your abdomen, there's also your referred pain to your flank area or to your back. Okay, kaya si patient natin, di ba, meron siyang complaints for your lumbosacral pain, which was identified as a sprain only. But then again, after it has been resolved, andun pa rin, consistent pa rin yung ating pain na nararamdaman sa harap at saka sa likod. Okay, so, you will have a question mark. What is basically wrong with this patient? That's why he was admitted for further evaluation. Okay, so that is your abdominal aortic. My readings mentioned that if you have an aneurysm that has ruptured sa harap, doon sa may peritoneal cavity natin, anterior part of your abdomen, immediately, this is going to be considered as very, very fatal. Okay? Yung manifestations na pulsation or heartbeat, sa anterior part yun. And your client will be suffering from a rupture of that one will mean massive loss of your blood. Internal hemorrhage ang magaganap dyan. Which is, again, kapag nangyari yun, it's going to also affect all of the vital organs in your peritoneal area. Okay. Now, if we have a rupture of aneurysm, that happens sa likod, posterior part ng abdominal cavity mo. And that is, di ba, close association sa kidney natin. Medyo mas okay yung prognosis. Okay? Medyo stable siya, kaya lang, kailangan mong hahabulin. Kasi meron pa ring internal bleeding na mangyayari. But since it's just going to be affecting only a few organs, and that's going to be your kidneys, okay, your kidneys, medyo stable siya compared to your anterior part that is affected by your AAA or your AAA. So, kaya lang again, the patient's condition might actually deteriorate kung hindi mo gagawa ng paraan, okay, if you don't do your surgical intervention immediately. So, again, hence, indications for your surgery needs to be if the client has a very large AAA or if there is already your rupture. Okay? Kailangan stat ang stat ang surgical interventions dito or else your client might end up dead. And usually, sabi ko nga, kapag rupture, it's about the loss of blood. Usually, it's going to be associated with your hypovolemic shock, a decreased cardiac output, decreased perfusion to your organs. That's the basic scenario when you have your unmanaged aortic aneurysm. Okay? So, next, similar yung aking discussion with regards to what happens with your aortic aneurysm. Ang difference lang nito is that your thoracic aortic aneurysm occurs in the upper part, above the diaphragm. Okay, above the diaphragm. Mostly, ang mga complaints nito would be associated with your thoracic mga vital organs. Chest pain, pwede po mangyari po yan. You get difficulty of breathing, but it's not associated with your respiratory ailment, but it's associated with your cardiac involvement. Pwede po mangyari yan. Okay? So, that's for your AAA and your thoracic aortic aneurysm. Let's move on to your brain aneurysm. This has been explained already to your LP in your cerebrovascular accident o di kaya doon sa lecture ng CVA natin. Aneurysm is very common. Ito yung example ko dati about my friend who actually fell on the ground unconscious and then nursed to the hospital and then found out na ayun, meron siyang brain aneurysm at the age of 18 years old. Okay? It happens to a lot of people. And usually, risk factors include, okay, although it was quite interesting in his case kasi bata pa siya, no? Pero, yung risk factors that are mentioned in several books, it says here that yung male population, sila, okay, the male population are highly affected by these aneurysms. Okay? Advanced age, you could also identify as one of the reasons why we have your aortic aneurysms or aneurysm in itself. And I mentioned earlier, your comorbidity, CAD, your coronary artery disease, your hyperlipidemia, hypercholesterolemia, yan yung mga reasons kung bakit meron kang alteration sa blood vessels natin. So again, we have here, this is an example of a berry aneurysm. Maliit lang po siya. Ayan, ito yung sinasabi ko din na watchful waiting. Kapag medyo maliit lang siya, hindi mo pwedeng galawin yan because you're going to have to suffer from more complications if you try to intervene. So it's really watchful waiting until it becomes a little bit bigger and hence it's going to be safer for the surgical team to operate on your aneurysm and do some, dito, pag nasa cerebral aneurysm, ang coiling. Yan, coiling. Naglalagay po sila ng coils dyan. Okay? Para hindi pupasok doon, dito sa part ng arterial wall mo, yung blood flow. Para dire-diretso siya in the usual pathway of your blood flow. Again, because your aneurysm makes another diversionary path for where your blood should actually flow. That should not happen because if it continues on, pressure will also increase and therefore you will have a rupture that's an impending event that's gonna happen. So again, with this particular type of aneurysm, coiling, sinasabi natin. Coiling ang usually na usual na surgical intervention for cerebral aneurysm. Okay? Next, let's move on. Peripheral aneurysm. Aneurysm that occur outside of your brain and call it your peripheral aneurysm. Saan sila? Doon sa mga large veins natin. Saan sila? Doon sa baba. You have your popliteal, you have your femoral, and also in your carotid arteries. So again, it's a matter of the risk factors associated. Maybe siguro si patient dati, meron siyang history ng deep vein thrombosis, mga ganon, o di kaya meron din siyang history ng other peripheral vascular disease. Okay? And even your carotid arteries, pati yung carotid arteries natin, pwede po yung maapektuhan. Okay? Di ba sa ating patients who are suffering from CVA, usually itong carotid artery ang tinitingnan din because it might be one of the reasons why we have your ischemia. So, this is basically very much affected. Madami pong kasalanan. Marami namang tinulong si carotid artery, but marami din pwedeng maging kasalanan ni carotid artery. A location wherein we have a lot of ischemia or occlusion that's gonna happen, and even your peripheral aneurysm. Okay? So, those are the different types of your aneurysm. We have your causes. Okay, paulit-ulit ko na sinasabi ko, di ba? It's your CAD, guys. Sorry. Something is wrong with my pen. Yeah, that's your coronary artery disease. It includes hyperlipidemia, hypercholesterolemia, cholesterolemia. Yan, ayan. Put a star on this one, smoking. One of the very reasons why people have an increase in your blood pressure and also abnormal alteration of your anatomical structure. Smoking po. Smoking. Hypertension, yes to this one. Vasculitis, ito yung sinasabi vascular disorders. Peripheral vascular disease. This is an inflammation of the affected aorta. And then, you have your drug abuse. And, well, if it runs in the family, then basically you have a percentage of actually also experiencing your aortic aneurysm, or maybe just your aneurysm for that matter, in the future. If not you, then your kids. If not your kids, then your grandkids. Okay? So, next, let's move on. You have your thoracic aortic aneurysm. About 1 in 4 aortic aneurysm occur in the thoracic area of the aorta, higher up in the chest. So, there are reasons why we have that one. We have your Marfan syndrome. Most of people who are diagnosed to have your Marfan syndrome, this is congenital disorder ha. Kung saan yung connective tissue natin para to give support to our organs for that matter, or other tissues for that matter, are non-existent. Most of these patients do not have enough bulk or do not have enough mass in their body. And this is associated to a DNA problem. A DNA problem. Most of them, payatot sila. Parang alam niyo yung they grow very, very tall, but they are very lanky. As in, do not have enough bulk, do not have enough connective tissue. Kasi nga, walang makakapitan yung muscles natin. Walang makakapitan yung mga ibang organs natin, usually affecting your eyes, your liver, okay, even your heart muscles for that matter. Wala siyang bulk. Yan yung Marfan syndrome natin. And it is a much less common cause of your aortic aneurysm compared to the other environmental risk, the other social factors, risk factors that I've mentioned earlier. Okay, this is thoracic pa lang ha, thoracic. And then you have your previous aortic injury or maybe a traumatic injury caused by a vehicle accident or a bad fall. Hindi lang bugbog, hindi lang hematoma ang pwede mangyari sa sa blood vessels mo. But, well, it can develop over time. Gradual ang development niyan. So, that is for your aneurysm causes for thoracic aneurysm. This one here, we have your brain, cerebral aneurysm. Again, weakness in the artery wall, usually present since birth. Hindi mo nga ma-identify na meron kang ganyan unless, of course, sabi ko nga, you have accidental evaluation. physical examination ka, and then there's a blood workup or maybe a CT scan workup, and then they only found out incidentally that you have this disease. Okay? I have reiterated this several times. Arteriosclerosis, I again have reiterated and emphasized this several times. Your CAD is a part of your CAD is the umbrella term for problems with regards to your coronary artery disease or your cerebral disease. So, arteriosclerosis, anything that has something to do with plaque formation in your blood vessels. Okay, most cerebral aneurysm develop at the forks or branches in arteries because the walls in these sections are weaker. Forks or branches. Yan. Dito. Pwedeng dito. Pwedeng dito. Okay? They mostly commonly form at the base of the brain but can form anywhere in the brain. So that is your cerebral aneurysm. And then finally, we have here, your abdominal aortic aneurysm. Ano yung mga signs and symptoms na nakikita natin from your AAA or your AAA? Unang-una dyan, sabi ko, di ba located siya doon sa abdominal cavity natin, very close to your abdominal cavity because it supplies all of the vital organs in your abdominal cavity. Hence, the complaint of the patient, if it's in the latter stage of your AAA, he will be complaining about a throbbing feeling in the abdomen. It's not painful, but there's discomfort. Okay? If we're talking about the initial phase, yung throbbing pa lang, wala pa yung pain. Kasi usually pain happens when there's already a rupture. But kung beginning phases pa lang ng, not beginning phases, but the latter phases, okay, not serious, not just yet, okay, you will have your throbbing feeling in the abdomen. You might even, for the critical cases, you will be complaining about deep pain in the back or side of the abdomen. What did I say? Can happen in front, anterior affectation of the vital organs there, or we will have aneurysm affecting the posterior part of your abdominal cavity, and that is what we call your retroperitoneal section. So, deep pain in the back or the side of the abdomen, retroperitoneal area. Kasi bakit kamo? Posterior yung aneurysm natin affecting your kidneys. Okay, next, you have your steady gnawing pain in the abdomen that lasts for hours or days. In the case of our client, hindi lang days yun months. Imagine that one. He has actually survived months of complaining about that particular pain. Sabi ko nga, watchful waiting. Okay. Swerte siya siguro that his body was able to accommodate your aneurysm, but only to a certain extent. Okay? So, if an AAA ruptures, what happens? Symptoms may include, ayan na po, yung medyo mas critical na condition para sa pasyente natin. Sudden severe pain in the lower abdomen and back. You will have your nausea and your vomiting. You will have constipation. You will have problems with urination. Bakit problems with urination? Kasi po, meron ka ng massive bleeding dyan. Okay? Massive bleeding, internal hemorrhage. Hence, if you lose blood, your kidneys will also be a self-sacrificing organ, not allowing elimination of urine to happen. No urine output because it's trying to save as much blood volume as it can because there's internal bleeding happening inside already. So, problems with urination might mean no urine output. This is a case of a client might be suffering from hypovolemic shock. Kasi asaan yung blood niya? Nandoon, covering your organs and not inside your blood vessels. Okay? You will have clammy, sweaty skin. You will have your diaphoresis, lightheadedness, rapid. Most definitely, please encircle this one. Sabi ko, hypovolemic shock. Okay? Hypovolemic shock, guys, because there is massive internal bleeding. So, yan yung AAA natin. Let's go to your thoracic aortic aneurysm. Kasi mas malapit siya sa taas. So, technically, your manifestations will be seen in the areas found upper torso. So, you will have pain in the jaw, neck, back, or chest. Similar to when you are having referred pain ng myocardial infarction. And sometimes, you might even have, sabi ko nga, The difficulty of breathing, shortness of breath, might even be associated with chest pain, but there is no cardiovascular involvement here. This is a matter, or this is an ailment associated with your blood vessel. Not the heart. Well, you could say konting association kasi nga cardiac output. But most definitely, kasalanan siya ng blood vessels na medyo weak. Or not just medyo weak, but really weak. Okay? So you will have coughing or shortness of breath, your troubled breathing, you will have swallowing impairment, you will have loss of voice. If, in any case, you have your thoracic aortic aneurysm, that will rupture or will dissect. Anong mararamdaman mo? Again, extensive coverage of the pain, having referral to other areas. So, magsa-start siya dito sa may upper torso mo, tapos pupunta siya sa upper back, moving down into your abdomen. Kasi nga, that's your thoracic cavity. Okay, that's the placement of your thoracic cavity. So, manifestation is always dependent on the location of your aneurysm. Okay? So, pain in chest and arms, and patient can quickly go into shock. Okay? Basta meron kang rupture dyan or leakage, immediately understand that there is your massive internal hemorrhage and hence, massive bleeding, massive blood loss na lumabas doon sa vascular compartment natin, and hence you will have your shock. Cerebral aneurysm, well, very likely associated with your stroke. Stroke yan siya. Pwede siya, kasi aneurysm and then hemorrhagic stroke. Ruptured aneurysm can actually be associated with your hemorrhagic stroke. So, neurological deficits ang makikita natin dyan. You will have headache, you will have your nausea, you will have your vomiting, eyesight problems, blurring of vision, and then temporary blindness for some instances, you will have your seizures. Put a check mark on that one. Ayan o, seizures natin. Loss of consciousness, obviously, confusion, drooping eyelids, stiff neck, light sensitivity. You will have, ayan, aneurysm that's going to burst will likely cause you to have your hemorrhagic stroke. I have mentioned that one already. As in the case of what happened to my friend. Okay? Nangyari doon sa kaibigan, sa kabatchmate ko. Well, we were casual friends. But yun nga, kabatchmate ko. It's your cerebral aneurysm. It's too late for interventions to actually be given to him. Okay? Risk factors. What are the risk factors? Ayan. Sabi ko kanina, di ba? Hello sa mga lalaki dito. Yes. It can happen to you. It's a good thing that hindi pa kayo matanda because most likely the risk factors that's very, very high to occur is among male and advanced age. Okay? More likely, men have higher incidences of your aortic aneurysm. And yung mga advanced age, 65 years old and above. If you are a smoker, yes, you can tick off this particular risk factor as a reason why many people have your aneurysm. Family history, genetics, it runs in the family. If you have history of aortic aneurysm, higher possibility that you might also be manifesting the same condition later on in your lifetime. History of aneurysm in the leg. Sabi ko, peripheral aneurysm, other areas which has your aneurysm as well. Certain diseases that is associated with your CAD, your coronary artery diseases. Ayan o, hypertension and your atherosclerosis. If you do also have problems with your aortic valve, your bicuspid valve, because it has problems with your cardiac output, na naapektuhan yung pag-pump ng ating cardiac output. So hence, since it's also very much associated with it, it can also have an effect in increasing the likelihood of you having to experience your aneurysm. And we have your traumatic injuries, car accident or trauma. Sabi ko nga, hindi lang bugbog ang pwede mangyari sa iyong blood vessels. But yes, this can actually occur. And most likely, sabi ko nga, hindi siya immediately. It's gradual, guys. It's gradual. So, watchful waiting is still one of your most significant assessment tools for knowing and recognizing your aneurysm. Diagnostic test. Yan. We have your abdominal or chest x-ray, abdominal because it's for your abdominal aortic aneurysm. And you also have your chest x-ray because there's a possibility for thoracic aneurysm. We also have your ultrasound and your echocardiography, and this is going to show to you yung diameter. Di ba, importante na kailangan natin i-identify yung size and diameter of your aneurysm. Because if it's just small, it's watchful waiting. Pero kapag large aneurysm na siya, kailangan mo lang gawa ng paraan. You need to prepare yourself for surgical intervention. So, it's a very important tool to observe, monitor, and even suggest and recommend your interventions for your patient if you use your ultrasound and your echocardiography. Your CT scan also shows to you your size and shape, most especially very good in identifying your cerebral type of your aneurysm, plus even your AAA. Magnetic resonance imaging, if you would like to pinpoint the specific size and exact location kasi ilang cross-section yun, ilang plates ang pinapakita ng MRI, a bit more accurate compared to your CT scan. And you also have your angiography. So your angiography, since again, aneurysm is a condition that has something to do with your blood vessels, you might as well evaluate your blood vessels that are affected. So angiography. Test shows the amount and blockage, occlusions that might have occurred or maybe even tears in the walls of your artery. So you have your angiography to thank you for that one. So these are our diagnostic examinations. Si patient natin, meron siyang CT scan. Correct? Meron siyang ultrasound. Correct? Okay. So what are the management? Pag maliit lang, it's watchful waiting. Okay. Early management, it's always about watchful waiting and change in your lifestyle. So, as I mentioned kanina, we need to not let it grow bigger. Prevent the aneurysm from growing bigger. Pag mas malaki siya, mas high possibility for your rupture, and that's not one condition that we don't want our patient to actually be experiencing. Preventing or reversing damage to other body structure because kapag pumutok yan, pag nag-rupture yan, it's going to also affect all anatomical structures that is adjacent to that aneurysm. As in the case, yung sinabi ko kanina, when you have your rupture in your peritoneal cavity, all of the vital organs there are also going to be very much affected. Okay? Preventing or treating a rupture or dissection. When we say dissection, yun yung tearing, yung napunit ng layers ng ating arterial wall, kung saan nagkaroon ka ng weakness and then possibly a rupture. So whenever there is a rupture or a dissection, always remember, automatic yan. You need to have surgical intervention. Okay? And then, finally, we have allowing the patient to continue doing their normal activities of daily living. Obviously, after rehabilitation from the disorder or from the repair, then they can go on with their lives. Like what happened to our client. Unfortunately for our client kasi, it's not just the AAA, which is the problem. He also has other comorbidities. And actually, even after the endovascular repair graft has actually been done, ano nangyari sa kanya? Nagkaroon pa siya ng evisceration, nagkaroon pa siya ng dehiscence. Kaya yung recovery period niya, medyo matagal. Okay? But you need to allow these patients to become independent and self-reliant again. Because after they have recovered, they're going to go on do their ADLs on their own. They are not vegetables, guys. Hindi po sila vegetables. Okay? They can be mobile, they can do certain things after you have provided your repair. Okay? Medical management. What are the management for medical medicines, mga pharmacological interventions natin in aortic aneurysm? It's always about pressure, blood pressure. Kasi diba weakening yun eh. Puputok yun pag wala kang ginawa para ma-handle yung pressure. So, most likely, your antihypertensive medications should be provided to your patient. And at the same time, you need to relax your blood vessels. Okay? Imagine if you have your vasospasms there. Tapos meron ka pang aneurysm. Good luck naman. Tapos meron ka pang blood pressure. Well, you're just adding more insult to injury. Okay? So you need to have these medications for your patients. We could have beta blockers. Ano ba yung mga beta blockers natin, guys? Ano yung suffix ng beta blockers natin? Sino na yung sumagot kanina? Si Mr. Oh, I forgot. Who answered my question earlier? Mr. Hindi ko na maalala. Tsaka bakit 27 na lang yung nandito? 26? Wait nga lang. Yung mga wala dito, absent ulit ha. 27 lang ang nandito. You're supposed to be 39. 39 students. Bakit 27 na lang ang nandito? Sino yung sumagot ng tanong ko kanina? Mr. Altuna ba? Were you the one who asked? Ah, Mr. Bacalso. Mr. Bacalso, give me a number. Mr. Bacalso? Oh, isa pala siya sa mga wala dito. Ayan, sige na lang. Ikaw na lang, Mr. Altuna. Mr. Altuna, give me what is the suffix for your beta blockers. Calcium channel blockers also. Yes, correct. Example ng mga ulol natin. Meto ha, hindi metro. Metoprolol. Okay. And then, your calcium channel blocker. Correct. Yung mga dipin-dipin. Lahat ng mga ulol, lahat ng mga dipin, pwede mo siyang ibigay sa mga patients natin na merong aortic aneurysm. I mean, this is a standard interventions for clients who have your hypertension. Okay. Kung hindi nag-work yung mga oral medications natin, obviously, yung mga patients natin, bibigyan sila ng IV drips ng mga antihypertensive medication. And ang pinaka-mainam na antihypertensive medication drips is actually your nicardipine sa clinical area. Lalong-lalo na, if you're talking about very high BP reading of 280, tapos 200, ganun, usually, yan. This is most also given for clients who have your cerebral aneurysm. Okay, so importante yung mga calcium channel blockers natin sa mga pasyente. Ayan. Ayan, wait lang. Aortic aneurysm, I have read somewhere that yung mga patients na merong early indications, usually, again, sabi ko nga, lifestyle changes and prophylactic, sabi nila, prophylactic antibiotics. Antibiotics. That's for the early indications of your AAA. They're trying to associate the inflammatory process or inflammatory response na meron doon sa ating early signs and symptoms of your aneurysm. Okay? But most definitely kasi kapag aortic aneurysm, watchful waiting. And yun nga, surgical interventions only happens when there is already the the development of the size of your blood vessel. So, yun. And when you're talking about that one, it's always your endovascular repair and your grafts. Okay, we'll be talking about that one later. So, next, for your cerebral aneurysm treatment, painkillers. Ah, yes. Also, your aortic aneurysm will have your painkillers. Okay, painkillers ang pwedeng ibigay kasi nga, sobrang sakit yan. Usually, yung mga patients will be complaining about 8/10 or 10/10 na pain. And then sometimes it's not just on one area, di ba? Sabi ko, it also has your referred pain at the back, okay, or even in some other areas. So you have painkillers, your calcium channel blockers, vasopressors, mga vasopressins natin. Examples ng mga vasopressors natin, they are your adrenergic agents. Yes, Mr. Altuna, can you give me a number? Let's call other people in the class. Number 2, Miss Alhambra. Hello, Miss Alhambra. Ikaw ang gusto na sumagot ni Mr. Altuna. Miss Alhambra, can you give me examples of your vasopressors? Tandaan ha, I would like to give you a hint. Ang patient natin, meron siyang massive bleeding sa loob. So, ibig sabihin meron siyang shock. Ano ang mga medications na dapat mo ibigay? It's your vasopressors. So, give me an example of these medications which tries to raise your blood vessels and tries to increase your cardiac output. Yes? Ano yung mga gamot na to? Yes, Miss Alhambra? Correct. Ano pa? Dopamine lang ba? What else, guys? What else? Any volunteers would like to answer the question? Yes, sino to? Si Miss Alviar. Miss Alviar, Miss Ariones, Miss Arabe. Mauna muna si Alviar. Ha? Epinephrine? Epinephrine, okay. Pero, this is to be given in a drip. And usually, pang-acute lang yung ating epinephrine. Hindi siya indicated for clients who have your, massive bleeding. Yes, epinephrine is an adrenergic agent which increases temporarily yung ating cardiac stats. But, hindi siya indicated for clients who are suffering from bleeding and needing more cardiac output. Binibigay yung vasopressors para mapilitan yung puso natin na mas lumakas yung pressure doon sa vascular compartments natin or blood vessels natin para mas maraming mailabas na cardiac output. Okay, so epinephrine, it's only for a certain scenario. Like for example, when you have your CPRS. Okay, pagkatapos mo ng epinephrine na ilang ampule, hindi naman siya for long time. Hindi siya for 8 hours, hindi siya for 12 hours shift. Okay? So, epinephrine is okay as an adrenergic agent but not indicated for your increasing your circulation and for your massive bleeding. Okay? Yes. Anyone? Sino pa yun? Kanina na tinawag ko. Si Miss... wait lang. Sandali. Miss Alviar. Miss Alviar ba yung sumagot kanina? Sino yung sumagot kanina? Sino yung sumagot kanina, guys? Wala. Si Miss Arabe na lang. Sige, Miss Arabe, yes? Correct. Kapag meron kang dopamine, dapat automatic yun, meron ka ding dobutamine. Yes? Dobutamine. Right. Itong lahat ng mga ito, these medications are given as IV drips. So, pag sinabi natin IV drips, Soluset yung patient natin. Or, kung wala mang Soluset, meron tayong sinasabi na pre-filled bags. Yung mismong bag na mismo, yan na mismo yung merong concentration ng dopamine natin or concentration ng double strength, pwedeng single strength, pwedeng double strength ng gamot natin, tapos yun na yung hinuhook natin. Kung walang bottles, kailangan mong mag-aspirate, pwedeng sa Soluset. So, you have your specific methods or specific na mga delivery of the medications. But more importantly, tandaan, these are side drips. Okay, we call them your piggyback solutions that are given doon sa main line ng patient natin. And most of the time, itong mga drips natin, pag pinag-uusapan ng drips natin, we're talking about infusion pumps. Because you need to give accurate dosage of your medication to your patient so that you can do something about the increasing of your blood pressure, increasing of your cardiac output. Okay? So, vasopressors po, those are examples of your vasopressors. Your anti-seizure medications, andito na guys. Andito na. There is, in your AAA, your seizure is not a very common scenario. Okay. What is seen in your AAA is actually your pain, your nausea, your vomiting, ganyan, and your referred pain, these particular manifestations. Your seizures usually found in patients who are suffering from cerebral aneurysm. Again, similar to manifestations of your CVA or your stroke. Okay, kapag meron ka namang seizure, what do you expect that the doctor will be ordering? You will have your anticonvulsant, yan, Dilantin. Well, your Valium. Itong Dilantin kasi, yung levetiracetam, they are for long term. Yung Versed natin, your midazolam, your midazolam can also be given as reconstituted or combined with your crystalloid solutions such as your Quinine and Mesis, pwede siya. But more importantly, yung ating Valium, okay, yung mga diazepam natin, pwede din po siya ibigay sa mga patients natin na merong seizure problem, na merong aneurysm. Okay? Next, we have your ventricular catheter. Well, again, this is for your aneurysm na associated doon sa cerebral artery natin. But this is your VP shunting. Again, aneurysm. You know naman yung VP shunting, di ba? This is the catheter that's inserted at the back part of your nape, and then it's inserted to your ventricles. And then it scores through under that skin, dito sa may nape part natin. Tapos, ididiretso siya dito sa ating peritoneal area so that you will have drainage of your CSF from your brain. Instead of being stuck in your cranium, it's going to go and be drained into your abdomen. And then again, reabsorbed by your system. It's a mechanical way on how we try to decrease your CSF and try to do something about the pressure in your cerebral area or in your cranial, in your intracranial. Okay, so that is your ventricular catheter, or what we call your ventricular peritoneal shock. Okay, this is done so that you decrease your intracranial pressure. Next, you have your rehabilitation therapy, because this is talking about your cerebral aneurysm. We have your rehabilitation therapy, we have ng PT, physical therapy, OT, speech therapy. Kasi nga, these are the neurological deficits that are seen in cerebral aneurysm. Physical therapy, they cannot move their limbs. Okay? They have difficulty in performing large motion activities. Even mobility is a problem. So we have your physical therapy, and then you have your occupational therapy. Mga fine motor movements like brushing teeth, eating, holding your pen, even holding your glass. That's your occupational therapy. And then finally, because neurological deficits din ang nakikita sa ating cerebral aneurysm, then ang pwede natin ibigay sa kanila ay speech therapy because they have problem with their communication. They have your aphasia. Okay? So those are for your cerebral aneurysm and your AAA. And then next, we have surgical management. Ano mga pwede natin i-consider for surgical management? You have your open, yung nangyari sa patient natin, di ba? Open abdominal repair. Okay? Ang ginagawa nila dito, they will have a very huge cut in the abdomen, especially in the abdomen. Anything that has something to do with your abdominal surgery, you will always be associating, especially kapag extensive yung affectation ng ibang organs. Talagang gumagawa sila they're going to make a very huge incision in your abdomen. So, large abdomen. So, general anesthesia, obviously, this is a major operation. And they're going to be removing your aneurysm, but at the same time, you will have your graft. Then, a graft is made out of your Teflon or Dactron. Alam niyo yung sa ating peritoneal dialysis. Di ba meron silang i-insert na parang catheter dito sa tiyan natin that would facilitate the removal of your fluids with your toxins. Okay? So, similar composition ng material ang gagamitin nila to be inserted in your blood vessels. So, this is your blood vessels. Okay. May problema yung lining. May problema yung lining ng ating, mali lang ha, pangit yung drawing ko. Yan. So, ito yung problema ng lining ng ating yan. Tatanggalin nila itong weak part. Tatanggalin nila itong weak part na ito. Open nila yan. And they're going to place a graft. Suture nila itong part na ito. Suture nila ang part na ito. They need to replace that weak vessel, part of the wall of your artery. Papalitan nila yan. Kasi nga, ang aneurysm na may weak na or maybe ruptured or dissected na part ng artery natin has a possibility of rupture. So before the rupture actually happens, or if the rupture did happen, you need to remove that affected wall of the artery, and they're going to replace it with a new one. Obviously, you cannot find extra blood vessels, right? It's very difficult, especially if you're talking about arteries. Most likely, pwede ka maghanap sa veins, pero artery, hirap po yan. Hirap po yan. So, they're going to place a graft, okay? And then they're going to suture it there, okay? i-attach nila dyan so that when it's going to be repaired, you will have your blood flowing freely with no problems. Okay, in the weak part na affected dito. Okay, so you will have your normal blood flow already kasi nga, it's already a graft that can accommodate the pressure of your blood circulation. So, wala nang problema doon. There's no more bulging there. There's no more dissecting because you have replaced that weakened or destroyed part of your artery. So, that's what your graft actually is. Okay? Next is you have your endovascular repair. Endovascular repair, hindi nila tinatanggal yung aneurysm. Ito kasi yung sa graft creation natin, tinatanggal nila kasi papalitan nila. Okay? Papalitan nila. Dito naman sa ating, let me erase. Let me erase. Your endovascular repair, you're going to be placing yung mga stents or even grafts. Okay. So, meron ka dito. This is your aneurysm here. Yan. Ayan yung aneurysm mo ha. Ito yung mga weak part natin. So, ito yung target na area natin na kailangan na i-improve. So, sabi dito, the aneurysm is not removed. It's allowed to be maintained as such. Kasi, pag tinanggal siguro or you do something about that, it's going to cause you more complication. What is going to be done here is that you will have your graft. Yung graft na hindi tinanggal. Okay, graft na hindi tinanggal. You will have your insertion of a catheter. Tapos, sa catheter na yon, insert siya dito sa may femoral artery natin. Sa baba. Okay, sa baba siya. Femoral artery. And thread hanggang doon sa may aorta natin. So, from femoral artery, di ba? Ito yung femoral. I'm going to draw. Ito yung femoral artery natin, guys. And then, very close to your aorta. Yung aorta natin. Yan yung femoral artery. Femoral artery. Yan. And then going to your aorta. Sa gitna. Sa gitna. So, they're going to be utilizing radiologic studies para makita nila kung saan pinapasok. So, yung graph na sinasabi ko, we also call it as your stent. So, from ipapasok dito, let's say, this is your femoral artery. Ito, ayan. Papasok nila yan. Meron dito. And then, here's another one also. But more importantly, meron tayong stent. Alam mo yung parang umbrella. Similar when we have your discussion in your cardiovascular problems. Yung kapamilya ng PTCA, di ba yung PTCA natin is your angioplasty. It tries to balloon your blood vessels, specifically your coronary arteries, and then allows the diameter to grow bigger. Endovascular repair natin uses your stents. Okay, so uses your stent so that meron kang ilalagay doon. These particular stents, initially, maliit yun siya. Pero, kapag nandoon na yung catheter sa may artery natin, i-expand yung stent, and then, it's going to be covering already that targeted site. So, umbrella yan siya, parang umbrella na ganyan, tapos ganyan ang itsura. Ganyan ang itsura niya. Tapos, kapag i-open na yan siya, ang itsura niyan ay, wait lang. Ang magiging itsura ay similar to your graft na nandito sa taas na tecron or dacron. Pero step yan siya, guys, ha? Step yan siya. Ang pinaka-use niyan is, katulad ng graph, dito nadadaloy. This is where your blood flow will actually be passing through. Okay? And it will totally isolate already your weakened part of your artery. Hindi na madadaanan ng blood mo yung weakened part ng artery. So because there is that particular material that provides you a straight and direct line of your pathway for your blood, the weakened part or the destroyed part of your arterial wall cannot be affected anymore. So that is your stent and that is your graft. Okay? The difference between the graft that is done, yung open repair natin, is tinanggal nila yung aneurysm. Pero ito sa endovascular repair, hindi nila tinanggal. Pinabayaan lang nila na daan. Okay? Anyway, it's not going to be affecting so much the existing weakened walls. Kasi nga, you already have, parang meron kang system in place so that these weakened walls cannot be affected anymore. So, the graft, I've mentioned, is expanded inside the aorta and is going to be fastened in place to form a stable channel for your blood flow. So, the graft reinforces the weakened section of your aorta para hindi ka magkaroon ng possibilities for rupture. Okay? So, that is for your aortic aneurysm. That's how your surgical interventions actually happen for your aortic aneurysm. Now, let's move on to your brain aneurysm. For your brain aneurysm, sabi ko, surgical coiling. Ayun, yun pala yung nakalimutan ko sabihin kanina. Clipping and your coiling. I said that they can't, if you have your belly aneurysm, maliliit, pero sobrang liit lang siya, wala kang gagawin dyan. But if it has become bigger, ang gagawin nila is, you're going to close off. Okay? For example, this is your belly aneurysm. Yan. First one, sabi ko, is surgical coiling. You're going to put a coil there. And you're going to close off this particular area so that your blood flow will have a direct straight path without disturbing the weakened wall of your artery. In like manner, when you have your surgical clipping, meron silang i-clip dito, tiny metal. Yan. I-clip nila yung area na ito para dire-diretso ulit yung blood flow at hindi na ma-disturb itong existing weakened wall ng ating blood vessel. Okay? Same lang din when you also have your endovascular repair. Ito yung sinasabi ko kanina. Ayan no, that's your stent. Galing dito, pwede dito sa taas, pwede dito sa baba. So you have your stent there. Nakapasok siya doon sa tip ng artery mo, ng catheter mo. Kasi it needs to be threaded through your vein, your artery, your blood vessel. So, doon sa pinakadulo ng iyong catheter, meron kang stent. Kapag naipasok mo na doon sa location kung saan dapat siya ilalagay, sa kanila i-expand yan. This is how it's gonna look like. That's your stent graft. Okay. Again, the difference between your open repair is that they do not parts sa open repair. Pero kung graft lang naman ang pinag-uusapan, please allow this to happen so that your blood vessel will, your blood flow will have a direct path, not disturbing your aneurysm. Okay? So, yan po ang ating surgical repairs for your aneurysm. Next, prevention. Prevention is always better than cure. However, many people do not identify or do not recognize signs and symptoms of your aneurysm because basically it's asymptomatic in nature. If in any case, you are diagnosed to have aneurysm and small lang siya, the goal there is to prevent it from getting bigger and to have rupture. So a large percentage of aneurysm is associated with your CAD, atherosclerosis. So lifestyle change po ang pinaka-importante dito when you have a high possibility of contracting the disease or actually getting the disease. So smoking, big no. Keep your blood pressure control. Kung alam mo na may hypertension ka, dapat meron kang maintenance and you have to be compliant with this antihypertensive maintenance. Next, keep blood cholesterol levels under control. So, low fat diet is very important. Eat healthy, well-balanced diet, rich in fruit and vegetables, unrefined carbohydrates, dietary fiber, and good quality fats, as well as lean protein. Keep body weight within the ideal limits. So, BMI, dapat sa normal limits. At least 7 hours of sleep, quality sleep. And you have to have yourself checked every now and then. Kung ikaw ay matanda na, dapat as early as 50 years old, 45 years old, and above, dapat meron kang yearly check-up. Para at least naman, especially sa follow-caudal check-up ha, I mean, full workup, kailangan mong gawin yan siya. Lalo na kapag matanda ka, so that you can intervene if there are any abnormalities or any conditions that you might have na hindi nakita just by actually looking at you or just by your usual blood works. So, mas importante na you have that annual physical check-up being done to you, especially if you're already an older person, elderly at that. Okay? Complications. Paulit-ulit na lang to. Hemorrhage po, hindi po nawawala yan. So, shock and death are the usual complications as you see in patients who have your AAA or in patients who have your aneurysm for that matter. Myocardial ischemia, yes, kasi nga kulang yung cardiac output natin. Okay? Stroke, yes, especially when you have your cerebral aneurysm. Puputok yan, causing you to have your hemorrhagic stroke. Paraplegia, due to your neurologic deficits. Kapag yung area or the injury of your cerebral aneurysm actually affects your motor and sensory functions, yes, you can have your paraplegia. Anterior spinal artery can actually be interrupted there. Abdominal ischemia. So, wala nang magsusupply ng blood flow to your vital organs because where is the blood? It's covering your peritoneal cavity and not in your blood vessels. Hence, wala pong tissue perfusions doon sa ating vital organs. So, abdominal ischemia. Graft occlusion, well, this is associated with a surgical repair. Kaya, kung meron ka mang surgical interventions done because of your aneurysm, it's also still very important that you monitor your client's response and feedback after the operative procedure. So, yes, kasi it's mechanical eh. Hindi naman siya, hindi siya parang transplant. Like, when you're transplant, you have your biological tissues, right? But in this case here, your grafts and your stent, they are mechanical materials that are in place there. So, there's still a possibility that occlusion or blockage can actually occur. And even then, kapag hindi maganda yung pag-perform ng operative procedure, there could be likely infection that's going to happen there. Okay? Next, acute renal failure. Yes, acute renal failure. Bakit kamo? Because your abdominal aortic aneurysm is very close to your kidney. It actually supplies your blood circulation to your kidney, your renal artery. Obviously, kapag meron kang aneurysm dyan, tas pumutok yan, no supply to your kidney, hence you are at risk for acute renal failure. And then next, we have lower extremity ischemia. Again, it has something to do with your neurologic function, hindi nakakuha ng appropriate oxygenation sa brain, and hence your peripheral and motor movement are also affected. Nursing management, what are the things that a nurse should do for the patient? Unang-una dyan, being able to identify and recognize the signs and symptoms of the specific aortic aneurysm. Kung abdominal aortic aneurysm or even your thorax, malas-malas mo, dala-dalawa. Thoraco-abdominal, so you have your thoracic abdominal aneurysm that has happened to you. You will have your pain, you have your referred pain, not just in your in the chest part, but also in your abdomen. Tapos may referred pain ka pa sa likod, sa shoulders mo. So, recognition of these signs and symptoms is very important if you want to manage your condition properly. Okay? Again, assessment. Assessment lang to, pinaka-importante dyan. Kasi kapag na-assess ko ng properly yan, ma-relay mo yung information na ito yung mga manifestations ng patient natin, ito yung history ng patient natin regarding smoking, tapos yung doctor natin, gagawa siya ng orders for CT scan, orders for ultrasound, and doon lang ma-identify yung diagnosis ng patient natin. Hence, yung mga interventions will be done after the diagnosis of the patient is actually finished. Nursing diagnosis, ineffective tissue perfusion. Why? Because there's decreased cardiac output. There's decreased blood flow. Because there's rupture occurring there. There's internal hemorrhage there. There's decreased circulating blood flow for that matter. Risk for infection, it's going to be because of the surgical procedure. And this is abdominal. Okay? Or even in your cerebral. Okay? Alam nyo na yung cranial surgeries are actually one of the most sensitive and most actual or most prone to having your infection. Okay, cerebral surgeries or intracranial surgeries. And like me, you will also suffer from the same fate if you do not follow your strict aseptic control or strict aseptic technique in your massive incision in your abdomen for your repair. Okay? Malaki po talaga yung hiwa naan. So again, there is a risk for your infection. And then finally, we have your acute pain related to the pressure of your aneurysm on the nerves and post-operatively. So, hindi talaga mawawala ang pain kapag meron kang rupture na pinag-uusapan sa aneurysm. Okay, so those are your nursing diagnosis. What are your nursing interventions so that you can facilitate proper perfusion to your vital organs? Unang-una dyan, try to identify, especially if it's aortic aneurysm, try to identify the associated history of your chest pain or your abdominal pain. Marami kasing ibig sabihin ng chest pain sa abdominal pain. So, kapag na specifically recognize mo na, okay, this is a manifestation of aortic aneurysm, kailangan mong mag-anticipate ng diagnostic studies at saka surgery. Katulad ng mga sinabi ko kanina. You will have your ultrasound, you will have your CT scan, and you will prepare for your open repair. Or if you're talking about yung ating cerebral type of aneurysm, pwedeng malaman or pwedeng i-conduct yung ating clipping or yung coiling. Okay. Next, paulit-ulit, hypovolemic shock. Yes, hindi po nawawala yan. Examine your neurovascular distal extremities. You do your GCS. You do your checking for your muscle grade and strength. Okay, for your peripheral limbs, your upper and lower limbs. So, check for your 6Ps if in any case there is problems with your tissue perfusion. Okay, post-operatively, BS hindi po nawawala yan. Next is check for the bleeding. Kasi this is a massive major operation. So, check for yung ating signs and symptoms of shock. So, you have symptoms of shock. You have a drop in your PP, and an increase in your RR, and an increase in your PR. Yan o, hypotension, tachycardia, tachypnea, diaphoresis. So, kung meron kang signs and symptoms of shock, anong gagawin mo? Raise your, or elevate your legs, report to your physician because you might be needing to prepare medications. Adrenergic, vasopressors. Okay? Monitor laboratory values as ordered. Check for your urine output kasi si patient natin. Hindi ba si patient natin, naalala ninyo, after nung repair, there was problem with your urine output. 75 in one day. Tama ba? 75 in one day. And then apart from that one, there was also your leg weakness. So, those, kahit kung ganun lang na mga manifestations, those are cause for concerns that you will need to report to your physician immediately because there's a complication that's actually occurring already. Okay, so monitor your urine output hourly because it might mean na sobrang bagsak nung circulating blood volume natin, your kidneys aren't receiving enough tissue perfusion. Okay? If thoracoabdominal aneurysm repair has been performed, monitor for spinal cord ischemia. Bakit ka mo? Kasi nga, we have what we term as your posterior part ng katawan natin, which could likely also be experiencing yung ating pressure. So, if, for example, we're going to draw yung, ayan, itong area na ito, it's your anterior part. You have your spine dito, you have your, ano pa nito, you have your vertebrae dito, okay? Pero, sa likod na part, andyan yung kidneys mo, okay? And most likely, you also have your spinal cord in this area here. This is your vertebrae, guys. Okay? Posterior part ito, This is your anterior. This is your posterior part. Spinal cord. You have your vertebrae there. Then this is your kidneys dito. Kaya, kapag meron kang aneurysm that occurs posteriorly may pagkakataon na you might have signs and symptoms of your spinal cord ischemia. So, pain, numbness, paresthesia, weakness, neurological functions as well needs to be done. Okay, so neurovital stats needs to be done. So, that is for your tissue perfusion, problem kung bagsak yung ating circulating blood volume. Next, let's move on to your preventing infection. Strict aseptic technique, universal hand washing, check for your CBC, especially your WBCs, lymphocytes, leukocytes. Also check for your incision. Kaya doon sa ating patient, meron tayong problem ng dehiscence, and your evisceration. Yan. Anong gagawin mo kapag meron kang dehiscence or evisceration? Please get your moist OS. Cover it for the meantime. Cover that area kung saan lumabas yung intestines mo or nag-open yung ating suture. And then, immediately report to your physician or your surgeon because that patient will be transported back into your operating room and have the repair. Ito yung mga chances for infection to actually occur. Antibiotics, yes, there's antibiotics, obviously because you have had your repair. Okay? And then next, we have, for the pain, anong gagawin mo? Obviously, magbibigay ka ng kapag sobrang sakit na, you provide your opioid analgesics depending on the doctor's order because it's likely a problem of your blood vessels. So, pwede kang magbigay ng opioids dito. Next, but you have to be very careful kasi meron tayong problems for hypotension. So, you need to do it with caution. Kung hindi pwede yung opioids, then you could have your NSAIDs for that matter. Next, place the patient in comfortable position, provide your pain medication, keep the head of bed elevated to not more than 45 degrees. Post-operatively kasi, you have to consider yung mga suture lines natin. Kapag overstretch yan, magkakaroon ka ng dehiscence and evisceration. So, kailangan mo munang i-facilitate yung drainage ng mga fluids doon sa affected area and to facilitate also the reduction of your inflammatory response or edema in that newly sutured surgery. Okay? Assess abdomen for bowel sounds and distension, obviously because it is very adjacent to your GI tract. Okay? So, naka-NPO din yung pasyente natin for quite some time. So, dapat hindi natin siya ipilit. You need to have your peristalsis present first before you give your food for that matter. And if, for example, the client might also be suffering from constipation because of your post-operative procedure. So these are the things that you need to remember for clients who have your pain happening. Next, let's move on. Client education. Pressure ng blood at saka blood vessels ang puntirya ng aneurysm. So, it's important that we are compliant to your medication. Kung meron kang hypertension, you need to have your medications, metoprolol, you have your beta blockers, you have your calcium channel blockers. Discuss disease process of your aneurysm. Impending, there's such thing as impending rupture. That's why we need to have watchful waiting. We need to recognize the signs and symptoms, if there are any, for a client who has your aneurysm. And finally, we have post-surgical patient. Dapat mo i-educate yung mga complications na pwedeng mangyari if you don't follow doctor's orders and instruction. Yung mga infection, nosocomial infection after your surgical procedure, fever, inflammation, operative site, these are manifestations for nosocomial infection. So, you need to educate your patient to report any and beginning signs of this one, especially if it has occurred to your patient after operation. Yung patient natin, di ba, nagsuka siya, nahirapan siyang, there's still pain for that matter, there is your, there is your problems with your consciousness. So, yes, you need to report this one. This might mean infection. In the client's case, you might also have an association with your hemodialysis. Di ba, si patient natin nag-hemodialysis. So, pwede mo siyang associate apart from infection, maybe a complication or a side effect of the dialysis procedure. Okay? Encourage adequate balance intake for your wound healing, especially sa patient natin, lalo diabetes mellitus. So, dapat compliant din si patient sa mga DM medications natin. And encourage patient to maintain exercise schedule post-operatively. Sorry. Ay, nako. Bakit ba to? Yan. Early. What's wrong? Early ambulation is very much recommended for patients who have large abdominal incisions. As tolerated naman ha. Kung sakasakaling kaya mo na, and your wound is already stable, your wound has already healed, then it means to say you need to do your part for your early ambulation because it prevents you from having your lung collapse and other complications. So you need to inform your client to do that one. Okay, so those are our interventions, nursing diagnosis and management for clients who have your aneurysm in general. Do we have any questions, guys? May mga questions ba tayo? Questions, everyone? Wala. People who have left the discussion will be marked as absent. Only the 27 people who are here. Let me, sadali lang ha. I'm going to stop the presentation. Ayan. Kayo lang. Ilan lang nandito. Mr. Altuna, Miss Carino, Miss Alhambra, Miss Aba, Mr. Andrada, Miss Campos, Miss Arabe, Mr. Atijera, Miss Borja, Miss Anza, Miss Acosta, Miss Marquez, Miss Alviar, Miss Cubinal, Miss Ariones. Tapos biglang, yes, Miss Camaraw. Bakit nag-join ka? Tapos nawala ka kanina. Miss Abaga, Arat. I can see, yung mga nag-join lang ngayon when I announced that yung mga wala dito kanina absent. Nasahin ko ulit, Mr. Bacalsa, Mr. Madrid, Miss Asto, Miss Gakad, Miss Antolin, Miss Casilia, Miss Acosta, Miss Bibat, Miss Beliesa. Lahat ng mga hindi sinabi ko dito, yung wala nung binasa ko dito, they are considered absent. Okay? For those who I've read in this list, you have additional 5 points in your quiz for the evaluation day. For the rest of you who are not around, there are supposed to be 39 of you. Pero wala kayo. Good luck talaga sa inyo. Okay? If there are no questions, I'll be uploading our discussion in our classwork. And then, we don't need to meet tomorrow because I'll be giving you the whole time. Kasi nga, next meeting, 26, right? It's already 26 and we're going to have our skills enhancement again. And then on the 27th, we will have our evaluation day. So you don't have enough time to perform all of the tasks. Kasi panay doon group activity. So I'll be giving you the rest of the day tomorrow to work on the asynchronous tasks. Okay? So I hope everything is clear with my instructions. Do we have questions, guys? May questions tayo? Questions? Okay. If there are no questions and everything is clear, even the instructions for your task, let us call it a day and goodbye, everyone. Have a wonderful Friday and have a wonderful weekend. Bye, everyone. Okay. Bye-bye. Sige po, ma'am.